Okay, it looks like we are at the top of the hour. We're going to go ahead and get started. Good afternoon to everyone. I'm Valerie Weber, and I serve as the Community Impact Director here in Akron, Canton, and Youngstown with the American Heart Association. I will be your host and moderator for today's community conversation. So today, this is part 4 in our series, and we will be discussing the importance of calling 911 at the first sign of heart attack or stroke, how our local first responders and hospitals are equipped to handle various emergencies amid the pandemic, signs and symptoms of heart attack and stroke among men and women, and strategies to support systems of care with health resources from the American Heart Association. As we begin our conversation today, please feel free to use the chat option to send comments and questions as our conversation evolves. We will have a Q&A toward the end of today's session, so we're going to go ahead and test out the chat option real quickly. So those of you that just joined, I want to direct you toward the bottom of your screen, and in the middle you're going to see a button that says chat. Please click that and say hello if you just joined, and we're going to test out the chat. And this is where you would be able to put comments in and enter Q&A, and feel free to do that at any point during our conversation here this afternoon. This conversation is going to run from noon until about 12:45. So we're going to end promptly at 12:45 to be mindful of everyone's time here today. So I am really pleased to introduce our panel of experts, and would like to take a moment to thank each of our panelists for taking the time today to bring their expertise to this community conversation during this very, very busy time. And I'm happy to introduce Ronald Maines. He's the Unit Director of Cardiac Quality at Altman Hospital. Dr. Ted Spangler, Emergency Medicine and President-elect at Mercy Medical Center. And Captain Pat Vodnar, EMS Coordinator at Canton Fire Department. And Alex Kuhn, QSI Director of Quality Improvement Initiative at the American Heart Association. This community conversation is powered by support from AlterCare. Thank you so much. So we're going to go ahead and jump right into our questions. And our first question is for Ronald. Ronald, can you tell the group here, what are the signs and symptoms of heart attack and stroke? And also, have you seen a decrease in the amount of people presenting at the hospital? Ron, I do think that you are on mute. You should see the, you should be able to unclick your mute there. Perfect.
Is that better?
Yep, I can hear you now.
Okay, thanks for having me here today. And thanks for organizing this call. It's true, many people think they aren't having a heart event if they're not having chest pain. And that simply isn't the case. Other common symptoms of heart events are other discomforts like pressure, for instance, between the nose and navel region. So namely, one or both arms, the upper back, the upper abdomen. You can have discomfort in these areas as well when you're having a heart attack. And other common symptoms are shortness of breath, unexplained sweating, nausea or vomiting, lightheadedness, or even palpitations. So there's a wide variety of symptoms that you can be having, either singly or in combination. Any of these symptoms could be indicative of a heart event, and you should seek care immediately. Stroke symptoms, we tend to summarize with an acronym, FAST, F-A-S-T. The F represents facial drooping or numbness. The A represents arm weakness or numbness. And then the S stands for speech difficulty, either being slurred or garbled, or even just the inability to produce words. And then T in FAST stands, of course, for time to call 911. So those are the symptoms that we try to make sure the community is aware of and can identify very quickly. Even if you personally aren't highly at risk for having a heart attack or stroke, somebody near you or a family member or a loved one could be. So you should still take the time to learn these signs and symptoms and know what to do when you see them. And that, of course, is call 911. The second part of your question was, I think, if we've seen a decrease in the number of people presenting at the hospital lately, and we certainly have. We've seen a decrease in a number of people presenting with heart and stroke symptoms. Not that there are less events happening, but we've commented that they're just not seeking care. So this means that the people that are presenting are waiting longer, and then coming in when their disease process is more advanced. So they're actually presenting in a sicker status. We've noticed a increase in cardiac arrests and deaths due to this delayed presentation and seeking care.
Thank you so much, Ron.
Sure.
We're going to toss it over to Dr. Spangler. And Dr. Spangler, can you touch on the differences are there differences between men and women when it comes to signs of heart attack and stroke? And why is it important to call 911 at the first sign of a heart attack or a stroke?
So I think those are very good questions, and I'll address both. I think Ron did a really nice job kind of talking about the spectrum of symptoms that one can have when they're having a heart attack. Classically, it's that crushing sternal chest pain, the feeling that an elephant may be sitting on one's chest, pain going down the left arm. We kind of know this to be kind of the classic presentation of people having heart attacks, but the reality is not everyone presents like that. There are populations, women being one of those populations, the elderly population, diabetic patients. We know that they can often present with a different constellation of symptoms that that we have to be kind of cognizant that those symptoms still could represent an active heart attack. To give you maybe some examples, so a woman might have milder chest pain. They may have just a sharp pain instead of a pressure discomfort. They may have no pain at all. Sometimes, the predominant symptom may simply be shortness of breath. Sometimes it could be some pain in the upper back or shoulder. Sometimes it could just be profound fatigue. So I think it's really important to educate the community that, we as providers are aware of this, but not everyone else out there may understand that those could be symptoms of the heart attack. And certainly that would warrant really immediate evaluation, by a medical provider in the emergency department. To the part B of that question would be, are there differences in stroke symptoms between genders? And I would say we see that less than perhaps, with heart issues. Differences in stroke symptoms are more likely related, I would say, to the specific blood vessel involved, or maybe perhaps a specific territory of the brain that's being affected by the stroke, but not so much due to gender differences. Second part of your question, the importance of calling 911, presenting to an emergency department immediately upon the first symptoms that a patient experiences. That's absolutely critical. And there's several reasons why. So, in a stroke, when you have interruption of blood flow to a specific part of the brain, brain tissue literally begins to die within several minutes. And there are treatments. We, as providers, talk about reperfusion therapy. We talk about thrombolytic therapy, specific drugs in stroke called TPA. The community may have heard these referred to as clot dissolving medications. But there are treatments in stroke that have been shown to improve outcomes. But what may not be as well known is that these therapies, there's a specific window of time where patients can receive these, typically between 3 to 4.5 hours. And if a patient presents outside that window, they won't be offered that therapy because it becomes ineffective, or the risks become greater than the benefit they provide. So, I see many patients that with stroke symptoms, 12 hours after they started, maybe 24 hours after the onset, and I will ask them, what prevented you from coming in immediately? They will say, well, I kind of wanted to give it some time. I thought the symptoms might go away on their own. Unfortunately, that's completely the wrong approach. It's so important to come in immediately when the symptoms start, because it gives us the opportunity to provide effective therapies. And lastly, I'll touch on the heart. I think most have heard the saying, time is muscle. Similar to stroke, entire systems of care have been developed to expedite the evaluation, the diagnosis, and the delivery of treatments, for heart attack. At Mercy, where I work, we have a cardiac catheterization lab in the emergency department, for exactly that reason, because there are times when we can, triage a patient directly from the ambulance, directly into the cath lab, and have the heart team waiting, because we were able to recognize a heart attack, by our partners in the field, the paramedics. The sooner these treatments, these reperfusion therapies are implemented, the better the outcomes. And what that means for patients is improved survival and improved quality of life. So.
Thank you so much, Dr. Spangler. That's actually a perfect segue to our next question, and we're going to toss it over to Pat. So Pat, when someone dials 911, how are they cared for once EMS arrives? And also, can you describe the ECG machine patients are hooked up to, and how is this information transmitted to the hospital to help speed up care?
I can. Both Ron and the doc talking about both these events that you're talking about today, cardiac events and stroke. It's all time is of the essence, and the way that we care for people, we try to get as much information that we can gather as quickly as we can gather, and then get that to the hospitals so they know what's coming to them. And all this information gathering starts actually with the call or dispatch center. And all dispatch centers are trained to gather that information over the phone to get as much information to us before we even arrive at the patient. And then we bring all the equipment with us now, and things have they've changed a lot in my 25 years since I've been here. But as the doc says, we try to get all that information gathered as quickly as we can to get it to the people to make those decisions that can get that care to the people as fast as they can. Going back to the cardiac events for us, and this is from the AHA, we understand and our dispatch centers know the importance of compressions right away, and then getting a defibrillator on somebody right away. That's past like an MI, somebody having a heart attack or something, that we want to get the information and get them to the hospital. But everything is time sensitive. Minutes are heart muscle, minutes are brain, and we're all geared that way to get them to the hospital as quickly and safely as we can. Going to the monitor, I just happen to have, hang on a second here, hopefully. I have some visual aids for us here today for a minute, if you give me just a second.
Awesome, thank you.
That's all right. So this is the actual monitors that we bring with us when we come to the patient. And you can see I have a generator on right now that's generating a rhythm for us. So one of the things for somebody having a cardiac event, what we want to get right away as soon as we can is a 12-lead EKG, and then get that information to the hospital as fast as we can. And this is the device that we do it with. So I have it hooked up right now to do a 12-lead, and it is acquiring that right now. I put in the information before about it. We put in age and sex of the patient, and then it'll acquire the 12-lead, and then it'll spit out a strip for us to read. And actually, the strip actually has a diagnosis on it sometimes if there's enough information for it. And this one actually says MI. Okay, it actually says it's an elevated ST. So at that point, with our monitor, what we can do is transmit to the hospital, and we have our different sites already programmed into it. I'm not sure if you can see those, but we're fortunate enough in this area to have 2 quality hospitals to transmit and deliver our patients to. And then we hit send, and that's pretty much it. It'll acquire a signal, and then it'll send that information to the hospital. I know this happens at Altman because I used to work there part-time, but also I'm pretty sure it happens at Mercy too, where it prints in the ER and it actually prints in the CAS lab also. So they have that information well before we arrive at the patient.
Excellent. Thank you so much, Pat. Thank you for the visual. That is very helpful, and I imagine very helpful for many folks that are on the call today. So much appreciated.
Yeah, some of the times we show up with this stuff, and it's kind of scary, all the stuff that we bring in, but it's all necessary. It's a scary time for the patient. And our guys, we're aware of that. And like I said, we try to get through it as quickly as we can and get them to where they're going to get their care. So,
excellent. Thank you so much.
You bet.
We're going to toss it back over to Ron and Dr. Spangler. Next question is it safe to come to the hospital? If and when a patient is transported to the hospital, what is the protocol to keep the patient safe? Many are hesitating calling 911 due to COVID-19. What steps are being taken to ensure they will not be exposed when presenting to the hospital for a non-COVID related emergency? And we can start with you, Ron. Ron, I think you might be on mute.
You'd think I would have learned it the first time.
Okay.
I was just saying that's an excellent question because, as we mentioned earlier, people have been delaying seeking care for their symptoms. And yes, it is definitely safe to come to the hospital. In fact, I want to reiterate that the hospital remains the safest place to be when you're having a heart attack or a stroke. The interventions that have been put into place since the pandemic have been pretty widespread, I know, throughout both facilities, but specifically at Altman, all staff in clinical settings are wearing masks, and all patients that are not already wearing masks when they arrive are given a mask upon arrival. And all visitors are also required to wear masks. So every entrance into the hospital does have a screening area set up so that there are hand washing stations, and everyone's temperature is checked, and they're asked a brief few questions regarding symptoms before they are allowed entrance into the facility. And of course, they are given a mask if they don't already have one of their own at that time. So there's those types of interventions at the entrances. Also, though, the rigorous cleaning and sanitizing protocols that have been put into place. Patients' rooms and equipment are cleaned in between every single patient, as well as there is deep cleaning with utilization of a ultraviolet light robot technology that's done at least once a day with all rooms, and more often as necessary. So these are things that have been put in place across all of Altman's facilities. And, you know, as I think I mentioned earlier, each layer of protection helps reduce the risk of transmission from person to person. So each thing that we do to add a layer of protection, even into the community, such as wearing masks as much as possible, washing our hands frequently, and practicing social distancing, these things all add a layer of protection, and cumulatively can drastically reduce the risk of transmission from person to person. So I guess in summary to that, yes, the hospitals are definitely a safe place, and the safest place to be if you're having heart attack and stroke symptoms.
Thank you so much, Ron. Toss it over to Dr. Spangler and the same question.
Yeah, I agree with everything Ron has said. I would, yes, absolutely. The hospitals are safe, and I would build on that a little bit. I mean, certainly, I think all hospitals are taking the safety of patients and staff very, very seriously. Adhering to the CDC guidance on how to accomplish that. I'll speak a little bit, about kind of the experience one might have in the emergency department. Since I work primarily in the emergency department. So, I understand the fear. When we think back to like what we were seeing on the news back in March and April, we were seeing, news footage from the metropolitan epicenters like New York City, where the emergency departments were just being overrun with COVID-19 patients, and you would see these, kind of images of just stretcher after stretcher after stretcher of these patients lining the hallways and coughing, and it's really kind of frightening, But I will tell you that is just not the reality in Stark County, Ohio. We, fortunately did not see the surge of COVID-19 patients like they did in some of these, metropolitan areas that have the very high population densities. And, at no point, did COVID patients kind of overwhelm, our area's healthcare resources, fortunately. But, when you come to the emergency department, any patient that may have possible COVID-19 symptoms, or anyone with suspected or confirmed COVID-19 disease would be immediately triaged to a special separate area of the emergency department, where they are separate from all other patients. This area would be kept in what we call, airflow isolation. It's kind of effectively a negative pressure area, where we have separate staff that provides care to those patients. We have all the available and necessary personal protective equipment, and it is completely safe for patients without COVID-19 to come to the emergency department to receive care. I think that's incredibly important for the community to know.
Thank you so much, Dr. Spangler. And just as a reminder for everyone, if you have any questions that you'd like to have answered, please put those in the chat box at any time. We're going to have Q&A toward the end of today's conversation. So we're going to go back over to Pat, Captain Bodnar. We're going to do a similar question for you. Can you talk to us about how is the EMS ensuring the safety of everyone once you do arrive on the scene?
We feel pretty fortunate. I'm kind of with the doc on this, and I thought we got on this relatively earlier as opposed to a lot of the rest of I don't want to say the rest of the country, some of the country, but I feel like we were proactive on a lot of what we're doing around here, and I think that speaks well to the numbers that the doctor was talking about. From the very beginning, a lot of the discussion on the EMS side, on the fire side, it has to do with the cleaning of equipment and your ambulances and your rigs, and then PPE. And a lot of that stuff, our frantic search at the very beginning for PPE, which still kind of goes on, but it's a lot better than it was. But from the EMS standpoint, we've always been, since I've been here, and it wasn't always like that, our PPE had to do with wearing gloves pretty much, and that was kind of the end of it. But now that's evolved into the masks that we're wearing when we arrive, N95 mask, which protects you and then other people too. And then also eye protection too, goggles and face masks. We have face shields, and we also wear Tyvek suits. That protects us. But we also have gotten in the habit now of any kind of respiratory problems. And actually, most patients that we deal with anymore, we are putting masks on them also. On the cleaning of the equipment, our guys are just really diligent about more. I don't want to say we were cleaning before, but they're just hyper cleaning now. And then we also have professional service coming in and sanitizing our ambulances twice a week. Some of the stuff is like a wake-up call. Some of it we should be doing all the time, and I know a lot of it. And I was just talking to some of our guys today. The the eye protection is just going to be a thing that's going to be normal for everybody going forward. It's just going to be something that you have to do. And that was, when I first came on, gloves was kind of a new thing back then, to tell you the truth. And there were a lot of guys, even when I started, that were really apprehensive about wearing gloves. And even patients that you approached would be offended that because you had gloves on that you thought they might have something. I think it's just a change in the way we do business, and it's just going to be the normal going forward.
Thank you so much, Pat. Excellent information. So what we're going to do now is we're going to toss it over to Alex. Alex, can you share how the American Heart Association is supporting quality systems of care?
Sure, absolutely. Can you bring up my slides? Or...
Yes, we can. Yes.
Yep. So I've had the great pleasure of working with Ron for, 15 years now, I think. It's been a long time working on systems of care. And we rolled out an initiative back in 2007, really to begin to work on heart attack systems of care to reduce the time from symptom onset to reperfusion. And we've spent a lot of time over the years working on that. And recently we've expanded that out to strokes and cardiac arrest, and really have been focusing on, how do we work in those spaces. And, if you go back to where we were back in, say, 2000, 2008, only about 50% of people in the country got a pre-hospital 12-lead ECG. Now when you look at the data, it's closer to about 90% of patients that are having heart attacks get a pre-hospital 12-lead ECG. And so that really helps to cut down the time from the time the EMS sees a patient to the time that they get their artery open, which really is at the crux of what we do with Mission Lifeline, is really, starting that system of care earlier. And so, again, if you go back into the 2005, 2006, a lot of the conversations with our hospital partners was that the care started for heart attacks began at the hospital doors. And we were able to push that back out and start the clock with the EMS providers. And so with Mission Lifeline, one of our primary goals is, getting patients from the field to the hospital, to the emergency department, up to the cath lab, and their artery open within 90 minutes. And when you look across the country, you go again back to 2007, 2008, roughly still only about 50% of patients were meeting that guideline recommendation from the American College of Cardiology and the American Heart Association. Today, about 80% of patients are meeting that guideline recommendation. And so, working with EMS, working with referral hospitals, those are hospitals that can't do primary PCI, and hospitals that do primary PCI, whether you're in Canton or Akron or Youngstown or many communities in between, you have a phenomenal system of care. Your EMS providers are doing great. Your referral hospitals are doing great. Your PCI hospitals are doing great. And, for most of us that have been working in the space for a long time, we've realized that, one of the greatest places of delay is with the patient. The patient doesn't call 911 or doesn't, delays too long. And so, this is not a huge surprise to us, now that COVID's here. It just amplifies, or dramatically emphasizes the need for us to get out and make sure we are working with communities to make sure that they're calling 911 for heart attack signs and symptoms, as well as stroke. And so probably about 2 or 3 years ago, we really began to dig into stroke a little bit. And again, the numbers are pretty close to the same. About half of patients are coming in by EMS, and they're still waiting roughly 3 to 4 hours. And, Dr. Spangler talked about that golden window for stroke care being at the outside window for 4.5 hours. So the patient's waiting 4 hours and EMS picks them up and gets them to the hospital really quickly. You're really not going to be in that golden window for the primary therapy for a stroke. And so we're really beginning to, emphasize our work around how do we continue to work with EMS and hospitals to make sure that there's a great system in care in place, but really, making sure that you do call 911 and that you don't delay when you have those signs and symptoms that Ron and Dr. Spangler mentioned, and getting to the system as quickly as possible. We have a lot of great information, on our website. I put a link down there. If you just go to heart.org and type in Mission Lifeline, You'll find a lot of our healthcare professional resources. And if you go to heart.org and type in don't die of doubt, you'll find a lot of our public education and public outreach information. Next slide. And we're excited, and again, I always want to give folks a pat on the back. And again, I've worked with Ron many, many, many years, and he has been a phenomenal champion with us for many, many years on building systems of care. And, every year we're always very excited to release the names of hospitals and agencies that are meeting our guideline-based care, as well as EMS agencies that are meeting our guideline-based care. And so there are a lot of resources online. If you go and look, you can find your hospitals that are certified as stroke centers, certified as heart centers, find hospitals that are meeting our guideline recommendations through recognition. And so these really, help us tell the story to communities about, hospitals work in EMS. Back one slide again. And so, I definitely, encourage, anybody to take a look at the resources we have. And I can't overemphasize, if you think you are feeling different than you usually do, whether it's the signs and symptoms Ron or Dr. Spangler talked about, call 911. I'm sure Chief Bodner will show up with his EMS providers and do a phenomenal job of checking you out and determining whether you're having an acute emergency and getting you to the right facility for that.
Excellent. Thank you so much, Alex. And we will be sure to share those resources with the group here as well. Alex, are there any other resources that you wanted to share that are available to the community, or just the links that you mentioned?
Yeah, so again, there are a lot of, links out there, but, I would start with the don't doubt or don't die of doubt link on our website. It will give you a lot of information about the warning signs for stroke and heart attack and cardiac arrest, and give you a lot of resources to begin to help you understand why you should call 911.
Thank you so much, Alex. So we're going to go ahead at this time and we're going to shift into our Q&A portion of the call. If you have not entered a question and you would like to, please feel free to do that in the chat option at the bottom of your screen. And I do believe we have a few questions that have already rolled in. So let's take a look here and we'll start at the top. What specifically, and this portion is open to all panelists, what specifically is your organization doing locally to get the word out to stroke patients to arrive early within the treatment window during COVID-19 pandemic? Any comments? And this would, yeah, go ahead.
Yeah, Dr. Spangler. So I think education is so critical, and it's participating in meetings like this for the community. It's getting education out. It's supporting organizations like the American Heart Association, doing the work that you guys do, which that's such an important tool to get the education out to the community. So I think that's what we try to do, is assist you guys doing your great work in every way that we can.
Excellent. And this is a perfect illustration. This webinar, this community conversation, is a perfect illustration of that. So we appreciate that. Next question is, are the hospitals seeing an increase in COVID now? Any comment on that?
I can speak a little bit to that. I definitely think that our peak was probably late April, early May. Our numbers have improved. To give you an idea, as of Monday, I believe we had 3 patients in the house with COVID-19. So the numbers are actually on the decline, and we hope they remain that way. But I think we have to, be cognizant of the fact that there could be a second wave that could come later this summer or potentially this fall as things continue to reopen. But as of right now, the numbers are in decline.
Yes, Valerie, if I can comment on that as well. We here at Altman concur. I would say that our numbers have plateaued a little bit. but we are definitely preparing for the possibility of a rise in numbers as we open up. So just a reminder to continue to practice all of the recommendations that have been mentioned, recommendations from the CDC and such as the social distancing and hand washing and wearing masks as much as possible. And then, because those provide, each a little layer of protection that together can help us all control and reduce the amount of risk of transmission.
Thank you so much. Our next question, is there a benefit to calling 911 versus driving yourself or having a family member or friend drive you to the ER?
Yeah, can I address that one?
Yes.
Please, yeah. There's a lot of things that could happen on the way to an ER in a car. We really don't want people that are experiencing symptoms like this to drive themselves. We can start care way earlier if we arrive, and we can continue care during the transport. It is really not a good idea for family members or yourself to drive yourself to the hospital.
Thank you very much.
I'll just jump
Go ahead.
in there too. Is when you look at the data, you save yourself about 45 minutes from the time that you would drive yourself versus calling EMS. There's just going by EMS will expedite the care you need versus driving yourself.
I wanted to, if I have time, Valerie, to build on what Alex and Pat have responded to that question. One of the benefits of calling 911 and having coming to the hospital via EMS is speed. Not only they can get you to the hospital quicker, but the speed of care. Pat highlighted that they bring the care to you, literally, with the EKG assessment and with the early identification and early notification of the hospital. That's accelerating and starting that whole care process much sooner than if you were to try to drive in or have somebody drive you in and then arrive at the hospital. But the other thing that is a really important factor, that now I'm talking specifically about heart attack, is when you're having a heart attack, you never know when you're going to, when the heart attack is going to interfere with the conduction system of the heart, with the rhythm system of the heart. And you can you're always at risk of suddenly having cardiac arrest. And obviously, if you're in a car, whether as a driver or a passenger, and you have cardiac arrest, the outcomes are very poor, not only for yourself, but you also risk endangering other people around you in terms of if that car were to wreck, or if the driver is so concerned and anxious about you that they wreck and drive off the road. We've actually seen that happen. I know Pat can easily think of several scenarios where he has witnessed the kind of event that I'm talking about. So it's incredibly important, with the risk of cardiac arrest always looming in the background when you're having a heart attack, to definitely call 911 so that as soon as they get there, you are in safe hands if a cardiac arrest were to happen.
Thank you very much. Really, really important points. And Ron, it looks like this one's a follow-up for you. People are still nervous about going to the hospital when having symptoms due to exposure to COVID-19. Are urgent cares a better option?
Well, that's an interesting question, Valerie. The urgent cares definitely have their place. Everybody is in a different situation in terms of their locale and where they live and what they have access to in terms of seeking care. Urgent cares certainly have been a benefit throughout the community. I know both hospitals have them throughout the community, and they serve a purpose. When you're having heart attack and stroke, we do have protocols in place at these urgent cares, so that if you were to present there and they identify that this is an event that is beyond the level of care that they're able to provide there, they know how to quickly accelerate moving you to a higher level of care. And that would involve the EMS community and getting you to one of the main campuses. So urgent cares definitely provide an access into the healthcare system that is necessary throughout the community. I guess I'll reiterate there that they are also taking all of the necessary precautions at urgent cares to make sure that during the pandemic, people are safe and they're not exposed to COVID-19, and they're protected from patients that might be infected by the virus. So those levels of protection are in place throughout at the urgent care level as well.
I'd like to build on that a little bit. I completely agree with Ron in the sense that urgent cares are a great way for folks to access the healthcare system for certain issues. But I would say that if there's any question that a patient's having a heart attack or a stroke, then I think the correct approach is, as we had kind of touched on earlier, call 911 immediately. And the facility that you want to be seen at is a local emergency department. The challenges at the urgent care is they simply don't have the capacity to diagnose, in a lot of cases, heart attack or stroke, and they certainly don't have the treatment available. So, if one was to, let's say, have an atypical presentation and went to an urgent care, absolutely they have all the protocols and processes in place to get the patient to a local emergency department immediately. But there simply is going to be that inherent delay in arrival to the emergency department. And that's going to, again, limit treatment options in some cases. And certainly you're not getting the benefits of more timely care that you might otherwise if you just gone to the actual hospital in the first place. So if there's any question, heart attack or stroke, call 911. You want to be at an emergency department.
Absolutely. Thank you so much.
Yeah,
Can I just add real quick on that one, Valerie? We're finding through this thing that a lot of people have been calling 911, and they don't want to go to the hospital. They just don't want to go. So to me, at least they called us, and we're at least able to assess them at the scene and give them a little bit of a judgment and an opinion on whether they do need to seek further care.
Absolutely. Very important point. So we've got just about another minute left, and we're going to take one more question here. Okay. Is the difference in time driving versus calling 911 45 minutes or 4 to 5 minutes? Locally, we have EMS within minutes of us. So Jack, I think I read that correctly. Anyone?
Yeah, it's not, the difference is not 45 minutes. In fact, it could be 4 to 5 minutes as far as our response to somewhere, but the amount of time, I think Ron touched on this, and maybe even the doc, the amount of time that you save in the overall process more than makes up for the dangers of driving yourself in or going in by yourself.
So, and then Pat, this will be a follow-up for you. How would the EMS help to assess someone that may be having a stroke in the field? Can you touch on that a little bit?
Yeah, it's part of our training is just assessing a patient from head to foot, especially for symptoms like that. We have a assessment that we do. It's called Cincinnati Stroke Scale. We just go through, and there's certain things like grip and speech patterns, and that if they're positive for any of those, we just consider that they're having a stroke. And then going back to the time thing and saving time with us being there, when we notify the hospitals of a positive case with that stroke scale, they will alert the stroke team before we even arrive. So when we arrive at the hospital, we'll go right to a room, and they're either on their way to the room, or most times they're in the room when we get there.
Thank you so much. So we are at time, so we're going to go ahead and close. And I want to again thank Alter Care for their support. This community conversation is powered by support from them. I'd also like to thank our heroes in closing, all of our healthcare workers that are out doing what they do for us. Thank you so much. I want to thank our panelists again for taking the time to bring your expertise to today's community conversation. Again, a big thank you to all healthcare teams across our region for your dedication and focus. And we also would like to thank all attendees and listeners for joining us today. And if our panelists have one more minute to stay on, if you have any remarks that you'd like to say in closing to the group, and I'll go ahead and open it up to our panelists for any closing remarks.
Yep, thanks for the opportunity. I appreciate it. If you do think you got a problem, call 911. That's the best advice I can give you, because the earlier we can get there and the earlier we can get you to the hospital, the better the outcome is going to be.
Excellent. Thank you so much, Pat.
You're welcome.
Yeah, that sums it up perfectly. Heart attack, stroke symptoms, call 911. It's the safest way to go. And thank you for having me today, and thanks for organizing this.
Absolutely. Thank you so much, Ron.
Mm-hmm.
Valerie, I'd like to just say the hospitals are safe. They've taken all the precautions to provide expeditious, safe care to the community. If you're having a heart attack or stroke, call 911. We're here for you.
Excellent. Thank you so much, Dr. Spangler.
I'll just say, again, you have phenomenal EMS providers working with phenomenal hospitals in systems of care to reduce the time from, symptom onset to definitive care. And the best way to get that care quicker and sooner and improve your chances for outcomes is calling 911.
Excellent. Thank you so much, Alex. And thank you so much, everyone, for joining today. We will be getting the replay link out to you later this week or early next week, along with the resources that